low back pain, and reduced blood flow. Hello, I'm Baram Jam. I'm a physiotherapist, and I'd like to take a few minutes to summarize a number of papers from across the globe associating reduced vascular supply to the lumbar spine with low back pain. Segmental lumbar and sacral arteries originate from the abdominal aorta, and they supply the lumbar spine. These arteries also supply the intervertebral discs, nerve roots, and the paraspinal muscles. Researchers in many countries have suggested atherosclerosis of the lumbar arteries to be a significant contributing factor to intervertebral disc degeneration, or IDD, chronic low back pain, and sciatica. This systematic review, based on 25 papers, assessed the associations between atherosclerosis and low back pain and found 1. Aortic calcification was associated with low back pain. And 2. Stenosis of the lumbar arteries was associated with both degenerative disc disease and low back pain. As you can see in the image on the right, a healthy aorta and lumbar arteries versus a calcified aorta with lumbar arteries that are blocked with atherosclerosis or plaque. The lumbar spine, which is supplied by these branching arteries, can suffer if the arteries become obstructed. Question: so what can cause obstruction of the lumbar arteries? And the answer is the same thing that can cause obstruction of the coronary arteries. Atherosclerosis is the thickening or hardening of the arteries caused by a buildup of plaque in the inner lining of an artery. The well-known risk factors for the blockage of the arteries include high cholesterol and triglyceride levels, high blood pressure, smoking, diabetes, obesity, physical inactivity, and eating saturated fats. So, what do cholesterol, lipids, diet, and atherosclerosis have to do with low back pain? Let's start with Korea. This South Korean study found that an inflammatory diet was an independent predictor of experiencing low back pain. We literally eat ourselves into an inflamed and painful state and then seek out passive care from doctors to intervene on our behalf. A higher intake of protein, fat, sugar, and calories shows a positive correlation with pain intensity and are characteristic features of the Western diet, which is associated with chronic low-level inflammation, and thus with chronic pain and pain intensity. This is a quote from a systematic review. Gut microbiome can cause systemic inflammation and inflammation in the central nervous system, which can contribute to pain chronification and amplification. And finally, plant-based diets might have pain-relieving effects on chronic musculoskeletal pain. Again, quoting the latest 2020 systematic review on the topic. Let's now go to Finland. Independent of BMI, this Finnish study found an association between high serum lipids and the presence of sciatica. Another Finnish study on almost 1,000 employees at an engineering company found baseline serum total cholesterol predicted new cases of radiating low back pain in the 5-year follow-up. Now let's go to England. This British study found that office workers with higher triglycerides had significantly more frequent sick leave and work absenteeism because of low back pain. What about down under? This Australian study on 1,500 senior women found that daily back pain was associated with greater risk of coronary heart disease. What do the Chinese find? This study found higher levels of serum LDL cholesterol and triglycerides in Chinese patients with symptomatic lumbar disc herniations requiring surgery. Serum lipid levels could be a useful predictor for intervertebral disc degeneration and symptomatic herniation. Is it the same in Italy? This Italian study also found higher serum cholesterol and triglyceride lipid levels in those who underwent surgery for a symptomatic disc herniation. High blood cholesterol and triglyceride serum levels are risk factors for atherosclerosis, which could be responsible for decreased blood supply to the already poorly vascularized intervertebral disc. Now coming to America. This massive 25-year-long American study found that advanced aortic atherosclerosis increases a person's risk for developing degenerative disc disease and low back pain. Atherosclerosis may contribute to intervertebral disc degeneration by reducing blood flow to the intervertebral discs, leading to decreased nutrient supply. Interventions targeting atherosclerosis may also have a beneficial effect on intervertebral disc degeneration. Our findings suggested that atherosclerosis may be an important modifiable risk factor for intervertebral disc degeneration, and strategies aimed at preventing or treating atherosclerosis may have benefits beyond just cardiovascular health. We can all agree that low back pain is complex and is rarely due to just one reason. However, the purpose of this presentation was to have healthcare providers at least consider reduced vascular supply to the lumbar spine as one of the many contributing factors to low back pain. Considering the undeniable association between low back pain and atherosclerosis of the lumbar arteries, perhaps healthcare providers may consider focusing a bit more on addressing certain lifestyle factors that may be contributing factors to reduce blood flow to the lumbar spine. Several potential interventions may help to reduce the risk of intervertebral disc disease, such as maintaining a healthy weight, quitting smoking, staying active, and managing underlying health conditions such as diabetes and high blood pressure. Too often, healthcare providers needlessly obsess over core strengthening, correcting postures, and irrelevant asymmetries, stretching tight muscles and joints. And way too often, healthcare providers focus just on offering painkillers and anti-inflammatory medications, when in fact, we should more often be recommending patients to stop smoking, reduce stress, reduce blood pressure, avoid sugars and processed foods, to eat more fresh fruits and vegetables, and most importantly, to exercise every day. In summary, with a positive mindset, all physical activities in conjunction with an anti-inflammatory diet have the potential benefit of reducing cholesterol levels, blood pressure, stress, and low back pain by improving blood flow to the spine. To learn more about effective strategies to positively change certain lifestyle factors associated with persistent pain, please visit thepaintruth.org and view the introductory videos. Thank you for joining me.